welcome to Healthy Kingston. I'm your host, Janet Witt. It is January 14th, 2021, and we are at the peak of the coronavirus pandemic, globally, nationally, statewide, and here in Kingston. So I thought it very important that we discuss it from our own perspective today. I'm sure you've heard a lot of numbers and you'll hear more today, but just a brief overview. Nationally, there have been close to 24 million cases, which is hard to wrap your head around, and 385,000 deaths. As far as Massachusetts, there have been 948,000 cases, and as of today, 13,359 deaths. Here in Kingston, we are in the red zone. And we have Dr. Marcia Herzberg, who is our health agent, who will be speaking a little bit more to the numbers in our town. But suffice it to say, as of today, there have been 644 cases in Kingston. And just in the past 2 days, since January 12th, there have been 15 cases. So obviously, our numbers have peaked, and they are more pronounced in short amount of time. So with that said, I felt that we would all be anxious to hear what our health agent has to say about the pandemic and the measures that are being met through the health department as to how to deal with these numbers in town, how we're going forward with the vaccine, and also the schools have been doing a tremendous job, and we're fortunate to have the nurse leader, Carol Beck, who is over the 6 nurses in the regional Silver Lake Regional School District, who will be addressing what the schools have been doing to deal with the pandemic among the staff and the children, and certainly the families. So with that said, thank you both very much for being here. Really appreciate it. Dr. Herzberg, we'll start with you first. Okay, the cases, 644, 15 new cases in the last 2 days. Can you tell us about some of these cases? Generally, where are they located? People want to know that. That's one of their first questions.
Yeah, so what we're finding is that the cases that are occurring out in our residents. The spread is happening out in the town, and we're not finding it happening at the facilities so much as we are with the residents. I was just on the phone a little bit earlier today, and this particular case mirrors somewhat what we see going on in the stories that I'm hearing when I'm doing my contact tracing. So we have an elderly couple that's hospitalized, and one of them is sadly comatose and expected to pass, resting comfortably with family, but very sad. Several family members became ill over the Christmas time holiday, and the elderly parents became ill, and it's just this type of transmission that is going through people that know one another. And,
well, that's what I was going to ask you, like, why the high numbers now? I think we all have a pretty good idea, but it certainly bears repeating. Why now are the numbers peaking?
So the holidays. This is the holiday bump that was spoken about by the governor, and quite frankly by numerous individuals on television nationally. We anticipated this. We anticipated a spike around Thanksgiving, and we anticipated this occurring at this time because when the holidays occur, people tend to gather together, friends and family outside of their natural households. And that increases the risk of spread because everybody has their unique opportunity for exposure. And now you're bringing all those different points of exposure together.
Right. Okay. Could you speak to local businesses? How would you say generally they're adhering to the measures that the Massachusetts Department of Public Health has put in place to prevent the spread of COVID?
I think that in Kingston, most of the businesses are good actors. Unfortunately, there are some temporary lapses that do occur. Those don't necessarily always mean that they have bad practices regularly, but that it happens. We're human beings, and unfortunately, there's some slips. And then there are some other facilities where they have taken a practice where they have decided that they're not going to adhere to mask wearing because customers don't want them to in a few instances, and that's not very many. And we're trying to get the message out to them that it's very important that they must do that, because we have to keep everybody protected.
So can you speak to, I know there's been discussion of the fines that are being put in place. So what is typical, using the chain of command, how you go about approaching a business and the fines that are in place, and how you typically have been administering them?
So a little again, but so what has been occurring is, because we've just got so much work on our plate with COVID alone, we have done what many other towns have done, which is to reach out to the town constables to help us. I have Arthur Boyle, who is a health agent with the town, as well as myself, and we get to places that we can and speak to them ourselves. And additionally, we have our constables that go out and reach out to different members of the community when we are getting complaints. These complaints come from members of the community who feel unsafe. They want to bring it to our attention of practices that they know don't adhere to the governor's orders. And they send us photographs in some instances. And we take all of our residents' concerns very seriously. And so we try to reach out, and we are trying to create dialogues with all of these businesses to get them, when there is a lapse in compliance, to become compliant. Now, I will say that with all of the businesses we have in town, we've only issued 10 citations. And once we get a plan of action in place with the business, and the business has a right to come before me as the health agent and to discuss the matter with me and tell me what they're going to do to correct it. And we sit down and we speak together, and thus far we have waived most of those fines because they've set up good plan of action. We've done follow-up, and we have found that they have put those practices in place. And
so typically they are approached twice. They are given 2 opportunities. Like, you will go and speak with them first and tell them what they need to do to be compliant, and then go back and check again to see if they've been compliant.
So what will initially happen is that one of the health agents or constables will go out and speak to them. And when we do follow-ups, if there's not compliance, then they have done citations. And as I mentioned, the citations themselves are more of a warning ticket. They do have fines attached, but that is to bring to the attention of management and ownership how serious this is. And again, they are able to speak with us. We don't want money. We don't want the money to come into the town to go to the general fund. We want compliance. We want to have our residents protected. And as I mentioned, with the few citations that have been issued, just about all of them, the fines have been waived as of today because of the demonstrated compliance. Once they received the citations, the owners and managers have spoken to me. I've gone back unannounced, or I've had somebody else go back unannounced. We found that they did enact the measures of compliance and that they are compliant now, and that's our ultimate goal.
Terrific, terrific.
So, yeah.
Can you speak to, briefly, just speak to the rollout of the vaccines? I know there's 3 phases and you're working on phase 1 and phase 2.
Well, so just to clarify, there are 3 phases, and we posted one of the infographics that's provided by the state on our website, and you can enlarge it. So in phase 1 and phase 2, it's centralized. It means that the state has control. There is no local control, except within a few communities where approval was granted for first responder clinics. And several of the towns banded together to do these first responder clinics. The rest of it was still centralized. So what you are finding that's been going on in nursing homes and in other locations has been through the federal partners and the partners that were approved by the state. The only thing that was done locally was the approved sites for first responders. That's all that we could do. Now, phase 2, we have absolutely no control over again, because that's also state. And the only time that we are actually able to intervene is in phase 3. And that's when it hits the general public. So the emergency response manager for the town of Kingston is our fire chief, Mark Douglas. Mark and I communicate daily. We have, I feel, an excellent relationship. And we have been working to open up a drive-through vaccination clinic for phase 3, where we can meet the needs of our residents. And the state has still not issued the guidelines. They still do not know how they're going to go about doing this. They're still working on it, but there are some basic logistics that they have put out there, and we've taken those and we have put in place steps so that we could meet the criteria to do that. So phase 3 is April through June. Okay. So we're hoping that the state will have things on track by that time. Okay. And we're hoping to have our clinic, we will have our clinic up and running whenever they give us the approval, because we have taken care of all of the logistics that we need to, so that we'll be able to get this up and going. Okay. I was going to give an update. So the state has changed phase 2 so that people who are now 75 years and older can go to the top of the list of phase 2. And there has been talk of lowering that to 65. So what I wanted to let people know is to check with your primary care physician, so that you can find out if there's any change. And you can see, because that's in phase 2, where they recommend that you go to get your vaccine as soon as you're eligible.
Well, I mentioned at the onset of our program that fortunately we've had a team of dynamic people working in Kingston to protect our residents. And one of those is Carol Beck, who is the nurse leader for the Silver Lake Regional School District. And she is over the 6 nurses that deal within those 6 schools. And if you're a parent here, you're well aware of what they've had in place, but we wanted the community to have a better idea as to what the schools have done and what they have in place to help keep the numbers down and keep the children and their families safe. Between the schools, there have been 124 cases up until today, up through the 13th. Between the faculty, the staff, and the students. when you look at the numbers of students and faculty you're looking at, is fairly good number. So you've been all doing a wonderful job. Carol, welcome. Thank you for being here. I know a number of people know you. You've worked within the school systems for 21 years as a nurse. And like any nurse, how could you retire? You just had to come back when they asked you in June. And fortunately, the other nurses have you to refer to with all that they've been having to go through in the pandemic. Could you please speak to what provisions are in place to help keep the faculty, the staff, and the students healthy during this time?
Sure, and thank you. Thank you for allowing us the chance to let everybody know what we're doing here. So some of the provisions that we're doing here is exactly what we've been doing from the beginning with everybody. We're doing face masks, face coverings, we're washing our hands, and we're doing distancing. There are also all the hand washing protocols in place, hand washing stations, sanitizing stations. Teachers and students are all doing a phenomenal job with that and with reminders. You know, all of these mitigating strategies always work best if they're layered. So that's what we do. We start from the beginning and then we just keep layering one on top of the other to form that protective piece.
And speaking of strategies, there's a whole continuum to this, as you're familiar with as a nurse, a continuum of care that these students go home and they have their own individual bubbles. So what would you suggest for parents and caregivers once these students are going home, or once faculty and staff are going home, to not bring back the organism to school?
Yeah, I think that I think just as everyone has said in education, that it takes a village. It takes a village to put strategies and keep strategies in place for COVID also. I think that one of the best things that we can ask of our parents is to just be good role models, to make sure that you're doing the same things that you're asking, you know, your kids to do. Make sure that they see you doing hand washing and wearing your mask when you go out and keeping your distance. So for the younger kids who might be a little bit more worried about everything that's going on, if they're seeing everyone doing the same as them and mom and dad say, hey, you know, we really all need to do this so we can just keep each other safe right now, that's helpful. And for the older kids, the high school kids, you know, peer pressure is very difficult, especially when they get in their cars and they're leaving school and they have their friends to keep their masks on. It's hard for them. So I think that just if parents can be watchful and remind the same way they would do for anything that they would say to their high schooler going out the door, it's just remember to wear your mask, do your distancing, and you know, play it safe and obey the rules so that you can help keep us all safe, because what you do does affect everyone in the communities, both school and outside. And
absolutely, good point.
Please don't
go ahead.
Don't send your child to school if they're obviously sickly or if they've had an exposure in the family or they're unsure. Please don't send them to school.
Well, the parents must be very cooperative, and obviously you're getting out good information, because I would imagine that's what you attribute to the fairly low numbers that you have.
Yeah, there's a lot. Again, we talk in layers. The in-school control that we have is one of the mitigating factors, I think, because it is a controlled space, and you know, we can be watchful at every moment. The nurse's office looks very different now. We have two separate spaces. We have a medical waiting room if we have students or faculty that have any signs of illness. They don't come into the regular nurse's office anymore. Students and staff members, if they develop any illness, During the daytime, they're immediately assessed, and if any COVID-like symptoms are present, they go out through that medical waiting room to a separate doorway, or parents will pick up at a separate place. And the nurses are having, take this moment to say the 6 nurses in this district are amazing, and I believe that they're a lot of the part of the reason why we're doing so well, because of what they're doing and mitigating every single day, and having their daily consultations, their weekly meetings, their trainings, the district trainings, the regional trainings, the CDC, everything that comes together, and all of those guidelines that can change on a minute, and keeping up to date with that, and keeping in line with all of those guidelines.
It's tremendous. Also want to give a shout out to the nurses who are working within the schools, and the fire department, and the EMTs, and those first responders and people on the front line who've been making a tremendous effort to keep us all safe and healthy. And it's very, very, very much appreciated by all of us. Again, we have to do our due diligence. It is tough. Wearing the masks and the social distancing, and we get tired of hearing it, and it can get a bit overbearing, but the repercussions, as we're seeing, can be tremendously serious. We are at the peak, and hopefully we're at the peak and we'll start to go down the other side. There are 3 phases, and the vaccine is coming, and people in the town, first responders, and then older people, and then the general population will be getting access to the vaccine within the next 6 months. And lastly, those of us who have children in the school system should feel very comfortable in that everything humanly possible is being done to keep those who work there and the students healthy. As Carol Beck very adequately said, it takes a village, and we all need to work together. So with that, stay safe. Nurse Beck and Dr. Herzog, again, thank you for all you do for our town. And stay healthy, Kingston.